Good morning, everyone, and a warm welcome to this pre-application and information session. We hope this will be useful to all of you, and thank you for joining us. So the way we will do this is we will give you some overview for the first 20 minutes or so, and this information is also being recorded. So if you missed anything, you can go back and watch it at your viewing pleasure. And we will leave some time at the end open to answer any questions. And that portion we won't record, just so in case it's very personal or something that's specific to you, we want to make sure that your privacy is maintained and respected. So why don't I kick off the session by first just briefly telling you who I am. So my name is Rita Popat. I'm one of the co-directors of the master's program at Stanford, and the degree is specifically epidemiology and clinical research, and the home department is Department of Epidemiology and Population Health. Um, Rachel, do you want to introduce yourself?
Yes. So hi everybody, I'm educational program managers. My name is Rachel Pham. I work with Dr. Popat and Latoya Powell to oversee the master program, and then I'm kind of in charge of the PhD program as well, related to all different aspects related to PhD student. Um, Also funding parts, research assistantship, teaching assistantship, fellowship. So welcome and thank you for being here. Latoya?
Hi, my name is Latoya Powell, and I am the Student Services Officer for Stanford Epidemiology. I basically will be managing most of the master's program as far as like application process, et cetera, and then also doing like a little data entry for like student funding. And then I manage the admissions inbox. So if you guys have any questions, feel free to email Epi Admissions. You can also email me directly. Thank you. Nice to meet all of you.
Great. So both Rachel and Latoya have amazing amount of experience and wisdom and knowledge base that extends my way beyond what I have. So I'm sure that if you have any questions, they will be happy to help you out. So this is just in case for those of you who are curious, what the heck does epidemiology mean? And the breakdown, it comes from a Greek word, and literally it's a study of something that happens upon the people. And I think you all probably connect this to the fact that epidemic is sort of the origin of the field of epidemiology. So this is a disease that happens very quickly and suddenly in a group of people and then just abates, hopefully. So this is just for your interest. So we've done this session before, and often I think many of you are thinking, well, why grad school and why specifically epidemiology? So of course I can come up with a long list of why go to grad school. By the way, I have two master's degrees and a PhD. So hey, you're looking at someone who just grad school is just so much fun. But let's be concrete. So why, right? So you want to invest in your future. It makes you better qualified. So even for a same job, and as we know, job markets have gotten so competitive in every area. Having an additional grad degree, puts already catches people's attention compared to someone who just has a bachelor level training. You have obviously through a grad degree have done further deep dive into the field, such as epidemiology. So you now have the toolkit to actually contribute knowledge. You get to work with the best because you will be in positions where you're working with researchers and folks who are doing cutting edge research. As I mentioned, you can get noticed. You may have your own personal interests for why you want to pursue and learn this toolkit. So this will give you the ability to do your own research and go into the depth of the questions that you really care about. You get to network. You all know, even undergrad, I'm sure you all made amazing networks, and you get to continue your network in grad school as well. And I just think grad school is just so much fun. So I just think being around curious, like-minded, diverse group of people who come from different backgrounds is the best way to grow, and people who will push you out of your comfort zone and will inspire you to, work hard and do your best. So enough said about why grad school. I think you wouldn't be here if you hadn't already realized why this is exciting for you. But why specifically epidemiology? So if you are interested in public health, or maybe have had some experience, or you're interested in medical sciences, or, so for example, drug development and things like that, or technology, as well as any health research fields. And so whether it's medicine, allied health profession, prevention, no matter what, community health, perhaps epidemiology might be the right fit for you. So why is that? Why an MS in epidemiology? Well, as I said, epidemiology is the cornerstone of population health. It informs our policy decisions, and in the medical space, uh, or allied health space, it is the foundation of evidence-based medicine. So how do you decide to counsel patients, to decide who gets which treatment, is all coming from sort of clinical epidemiology type questions. And how does the field of epidemiology go about making these contributions? Well, because the field is designed to understand risk factors for diseases and understand who is bearing the burden. So then you can evaluate and propose targets for treatment and prevention. And they don't have to be drug related or surgery related. These could be often through diet, better exercise, sleep. It covers the entire umbrella. So whether you're interested in genes or whether you're interested in non-genetic factors, epidemiology has a place for you because the toolkit can be used to study almost any risk factor under the sun. So as I mentioned, it gives you the skills that are essential to population-based study. And for those of you who are interested in the clinical space, this is the foundation to do clinical research. So anything that is related to learning about methods and statistical analysis, that's what the training in epidemiology will give you. So epidemiology is a quantitative field, and therefore there is a lot of emphasis on the quantitative side of things. We're always quantifying disease. In other words, we're measuring disease so we can ascertain who's at risk. We can then look at relationships between different exposures and our diseases. And that's what we mean by, our measures of association and how we quantify this relationship. So we do rely on statistical approaches to accomplish that. So if you land on our website, that's the Department of Epidemiology and Population Health, you'll see these two images that really speaks volumes for what epidemiology can do. So here we have Dr. Lisa Goldman Rosas does work on really improving chronic disease and prevention of chronic diseases like diabetes and heart disease in the underlying community. And she's working on like just prescribing and giving people a prescription to go buy fresh food, like vegetables and fruits, and whether that is going to impact health. So it's trying to get at, a lot of people don't have access to real food. And so then you rely on already processed, frozen kind of meal options. But here, and so I think they're doing a randomized study in the community to answer this question. Here's another study that some of our colleagues in the department just recently published that has gotten a lot of attention. And this is on, could measles actually become endemic in the US if our vaccine rates in immunizing children continue to decline? We're already starting to see some states that are saying you don't need to vaccinate your child before they go to school. So they did this interesting modeling study to see if indeed measles will become endemic. Now, this slide is just to underscore that epidemiology is the hub for no matter what your interest is. And so I don't have enough spokes to fit in this circle here. But if you're interested in neuro, that's my area of interest, that you can do neuroepidemiology. I'm also a clinical epidemiologist. If ID is what brings you joy, do infectious disease epi. You love genes, there's genetic epidemiology. You care about social determinants of health, there's social epi. You care about the environment, environmental pollutants, PFAS, fires in the Bay Area, for example, you've got environmental epi. You're interested in improving neonatal outcomes and outcomes in pregnant women. Well, you've got perinatal reproductive epidemiology. You want to know what are long-term effects of medications not using clinical trials, but observational methods. There's pharmacoepi. Into the global epi, we see many who've joined us from the global space. So as you can see, we've got a match for you. In fact, I can't even fit things like musculoskeletal epi, cardiovascular, and nutrition epi, and there are many, many more. Now, a question that we often get asked by students, and I also work and mentor and teach undergrads here at Stanford, is should I go for a master's degree, an MS, or an MPH? And so I'm just trying to very briefly tell you what the distinction is. So a master's in public health is generally a professional or a terminal degree that's often oriented towards practitioners. So often in MPH programs, you'll see doctors, nurses, maybe physician assistants, maybe dentists. So they have already gotten their professional degree. And this is a terminal degree because maybe they want to do work that impacts, the community and at the public kind of population level. So these programs generally tend to be shorter. They're generally a one-year program. Again, it depends on where you're doing this. It's usually within a school of public health. And often you don't need to do a thesis. You may be required just to do an internship. And they, at least in my experience, since I did get my master's in biostatistics from a school of public health, and we had a lot of MPH students, they didn't have to take very methodologically or statistically rigorous courses. So, if you really want to build the rigor and take more rigorous courses in methodology and statistics, you could perhaps include that in an MPH program, but there's just not enough bandwidth because these programs tend to be shorter, in which case an MS degree would be the right choice for you. So an MS degree, especially if you're interested in pursuing a doctorate degree or you're more research oriented rather than just serving in the community, you may want to consider an MS program, even if you're doing this within a school of public health. Now, just to clarify, because sometimes people are concerned, after an MPH degree, do you think I can get into a PhD program? And the answer is yes. So you don't need a master's degree to get into a PhD program. But I can tell you, an MPH is heading in the right direction. But again, I feel like if you are especially thinking about a doctorate, then your time is probably better served in getting a MS degree because it'll be a longer, generally a 2-year trajectory. Most programs will require to do a thesis, especially if you're thinking about a PhD. You want to make sure you really enjoy research. And so this is your best bet to test that out. Oh, sorry. Okay. So the other question we get asked is, and I'm sure you all are curious, well, who is in this cohort? Who joins the program at Stanford in clinical research and epidemiology? So let me give you a little bit of background of which sort of, what comprises our student body. So we have 4 types of students, and this is what makes our community a lot of fun. So we have clinicians. These comprise of fellows. So these already have finished their MD degree, and they've decided they want to do research in their specific area. And so they come back to learn these skills. We also have medical students, just not just from Stanford, but from other institutions who may take a year off, a year and a half off to come do the master's program. We then have coterms. These are uh, undergrads at Stanford who are applying to get a MS degree along the way. And so they, rather than spend 4 years on campus, they'll spend 5 years on campus. And then we've got the traditional graduate students who come from either from generally from other institutions and may come from international settings as well. So basically, half the class tends to be more clinically trained, such as medical students, fellows, and the other half of the class are currently, at the time they enter, they're non-clinical, but they may segue into either getting a doctorate or continuing on to they may be pre-med and planning to go to medical school. And our class size can vary between 28 to 40. So some years we see, I think 40 has been our largest class size. By the way, I know for some of you who come from larger programs, like, wow, seems like such a small group of students. And you'll be surprised to know that among the bioscience programs at the School of Medicine, ours is one of the largest class. And so even at 30, we're among the largest master's programs within the biosciences. And the reason is because Stanford is not a school of public health. It's a medium-sized institution compared to like UCLA and Berkeley and the other state schools or other public universities. But there are advantages to being small because the student to professor ratio is super small in the sense it's great. You really get to network and get to know not just your peers, but your faculty as well. So the other question we get, well, do I meet the qualifications to apply? What would make me a competitive candidate? The first thing we look for or we urge you to consider is, are you actually interested in the field? And if so, then you have to think, okay, well, how are you going to show your interest in the space? Especially we find sometimes students come from a complete basic science background, like your undergrad degree may be in molecular biology or something, and now you want to make the leap to epi. Well, if you've never taken an epidemiology class, you may think you like epidemiology as a field, but really you may not know much about it. So what I actually would urge you is to explore. So I have shown you a link here to our online certificate program in epidemiology and clinical research. This is not your only source, but you could say, okay, well, I've never done epi. Maybe I should try the certificate program first, because then I have shown that I'm committed, I'm interested, and you really get to test out. Because the coursework that is part of the online certificate program are many of the core courses you're required to take as a master's student. There are many Coursera courses too that you could take for free. This, of course, is not for free. So I think you should definitely be clear that this is the field you want to get into. Um, Having some experience. Maybe you've worked as a clinical research coordinator. Maybe you've worked at a public health agency. Maybe you've worked for, in a research organization or for an NGO. So having some experience in the area of either in the clinical space or in public health is also one way to reassure yourself that indeed you have some idea of what epidemiology entails and that this is why you're applying. And then how does it match your future goals? So I think it's clear if you want to practice public health, this is the right path for you. And I don't just mean public health, but population health. If you're interested in going to medicine or an allied health profession, all of these foundational skills will be informative and will just make you a better healthcare provider. So that's very clear on how this connects to your future goals. And you should have some quantitative foundation. So if you are, I believe in the growth mindset. I think anybody can learn, and there's no such thing as you have innate quantitative ability. Everyone can learn. But if dividing, multiplication, subtraction is not your favorite, that's a sign you may not want to consider this field. But so you need to show sort of and be ready quantitatively. So if you've never done a stats course or you just didn't have a good experience doing statistics in your undergrad, your journey as a student, or maybe somehow you weren't required to do this as an undergrad, and the last time you took statistics was in high school, your AP stats class, I might spend some time doing a Coursera course and doing all the work and just trying it out. Dr. Senani has an amazing, she has Coursera courses, she teaches other stats courses. So there are many other options. But you need to have some kind of quantitative foundation. So often we will look for, and, even if you haven't done stats, if you've done calculus, you've done linear algebra, like, and, you've done fairly well in those courses, then that, of course, is reassuring. Or some way to show that, yes, you have taken some, you have some idea of what this stuff, entails. Now, just very briefly, what are our degree requirements? Overall, students need to take 45 units of coursework to satisfactorily meet the master's degree requirements. And among these, about 18 units of our core courses. There are 3 methods courses and 3 courses in statistics, and they all build on each other. So typically it's fall, winter, spring. You start with the intro, then there's intermediate, and then there's advanced. There's also a 3-unit requirement for seminar. This is 1 unit each, and 12 units of a thesis. And so what you are left with is 12 units for elective coursework. That could be related to methodology or could be related to your specific area of interest. So if you're interested in global health, you would take kind of global health courses for maybe 6 units out of these 12. As I mentioned, the master's thesis is usually original research, but we don't expect you to collect data to do this. So you would be leveraging data that have already been collected. And if you are working along with an advisor who already has a research project that has generated results, or maybe they're finishing up a project, you can certainly, if they're mentoring you, you can use that for your thesis purposes. The typical length of the program is about 4 to 6 quarters. We tell people don't try to race through this. What's the point? Because you won't really truly learn the essential skills. You'll just be ticking boxes. But let's say you're planning to apply to med school and you need to finish this over 4 quarters. It is doable, but you need to hit the ground running. So I think it's safer to plan for the lower bound is 4 quarters, but usually students comfortably finish by 6. And I'm not counting the summer quarter because students are not required to enroll in summer quarters. So I mean 6 academic quarters, so fall, winter, spring. Now, where do our students go after graduation? Well, you have many choices. So some of our students go to work at the Department of Public Health. They go to work for a nonprofit. They may work with an academic research lab, or they may go to biotech, such as, Genentech, or any of the, pharmaceutical companies. People also go to places like Google, all of these big tech companies have like a health branch. And so there are opportunities there as well. I think mostly our PhD students have gone there, but some of our master's students have gone. They've even gone to consulting firms as well, consulting in healthcare. Some go on to pursue a doctoral degree in epidemiology or public health. Some go on to pursue medicine. Of course, the clinicians will often pursue a career in academic medicine, and our medical students are generally headed for residency after they finish their master's degree. So how do you apply? Our application portal is already open. Please note the deadline is Feb 3rd, 2026. You can submit your application to the Stanford grad website. We checked the link yesterday. It is live. You can actually go there. For those who are planning to apply to Knight Hennessy, here is the link for you to check out that information. I assume there are no coterms in this group, but coterms have a different deadline. Well, I think the deadline may be the same, but their application process is slightly different. I think their deadline is earlier too. Is that right, Rachel?
I think we set the same deadline for
Oh, it's the
quota.
same deadline. Okay, but their application process is slightly different. So
Mhm.
how best to prepare your application? Just keep in mind, the admissions committee is not just looking at one thing, right? They're not just focusing on your GPA and your transcript. It's a holistic review. They look at the whole package. So what does that mean? They look at your statement of purpose. Why are you interested in epidemiology? How does it connect with what you have already done and what you hope to do? You're going to require 3 letters of recommendation, ideally from people that know you, reasonably well. We're looking, especially if you've done research experience, or if you, took an epi class or a stats class. Like these are the folks, who are writing your recommendation. The GRE scores are optional, but if you think, you want to showcase your quantitative aptitude, we're not going to stop you because the GRE has the verbal, the written part, analytic writing, as well as the quantitative portion. So if anything, you do well, this makes your case, but again, it's not required. But again, I keep emphasizing, even on our application, we have a special section on tell us about your quantitative background. And so if you have helped with a publication, you've helped with a research project, you get to highlight those points. Latoya is going to talk about the TOEFL in a moment, so I will wait for that. And then, of course, you will need to submit your transcripts from all your undergrad and then some experiences, and then your updated CV that highlights your relevant work and research experience. Once you've submitted your application, of course, once the application is complete, we then send this to the admissions committee who will review everything, and then we get back to people about admissions decisions. For questions about tuition, and I think Rachel will address some of this, and funding opportunities, but this is the link for if you want to know the hard number that's involved, here is your link. And if you have any questions, you can, of course, post them at epiadmissions@stanford.edu. So that is sort of the main kind of overview. What I'm going to start with is we thank you all for submitting your questions. There were many, many questions. So of course we can't get to each and every one, but we tried to group them into common themes. So these were the 4 common themes relevant to me that emerged. And some of these you've already addressed, right? So I've already told you what qualifications would make you a competitive applicant. We've already talked about what type of employment do EPMS students obtain after graduation. And so we've talked about that as well. I've told you a little bit about who is in our program, what's the phenotype of the student in our program. So let me address the question that's bolded here. Do I need to have a research advisor as a master's student? The answer is no. We do not expect you to have and you don't even have to specify your specific research question. This is a master's degree. We don't expect you to know. This is a bar that's set for PhD programs where you absolutely need to know because you've already done some research in an area and you're interested. But for a master's thesis, for a master's application, you do not need to tell us and reach out to faculty and get their okay that yes, they'll be willing to advise you. You can always proactively reach out to people, but it is not a requirement. All we know is we just want to get a general sense of what your interests are, and you can mention which faculty you may be interested in working with. I will defer the question regarding TOEFL to Latoya, and then Rachel will answer the question about funding. And these were among the submitted questions. Latoya, you want to address the TOEFL and
Yes, thank you, Rita. Oh, excuse me, Dr. Popat. With regards to
Rika's
the,
all cool.
okay, awesome. With regards to the TOEFL question, I get that asked a lot, even in the admissions inbox. Um, I want to preface the answer to this question by saying that the department does not get to make decisions on TOEFL waivers. Those decisions are made by the Central Graduate Admissions Office. However, in general, students who are US citizens and permanent residents, or if you have English as your first language, or you've earned a bachelor's degree, master's degree, or doctoral degree at a school that is conducted in English, which of course would be US schools, or you have at least 2 years of experience, professional experience, 2 years consecutive experience within the last 10 years, in most cases, you will be granted a TOEFL waiver. In order to apply for a TOEFL waiver, you would submit that actually through the application. Yes. And then if you don't meet any of the criteria above, you generally will, or excuse me, if you don't meet any of that criteria, you generally won't be granted a TOEFL waiver. And as of this year, we actually will also be accepting the IELTS. This is the first time that we've accepted that. We haven't accepted it in previous years. Generally, you want to have a score for the TOEFL as a minimum of 90, and then a score to be exempt from an English placement test of 109. And for the IELTS, the minimum is 7 for consideration, and then a maximum of 8 to be able to waive having to take an English placement test or having to take an English course if you're admitted into the MS program.
Wow, thank you, Latoya.
And I just want to say that as Rachel is speaking, I'm going through the questions that have been posted. There are some interesting ones, and I think there'll be time to answer these. So I'll just wait till Rachel addresses the funding, and then we'll start answering your questions that you've posted in chat.
Yes. So regarding funding, our department doesn't offer funding upon admission. So however, the university often offers so many fellowships that are available to graduate students. So one of the fellowship, a Nine Hennessy Fellowship. This is one of the best fellowship at Stanford. So we encourage you to apply. During the last several years that I'm here, in average, I see 2 to 3 Nine Hennessy Fellowship allocated to our department to our first year. So please apply. Your chance is higher than in other departments to get this type of fellowship. So the Nine Hennessy Fellowship is available for first year master student, which means you are coming in autumn 2026. You can apply now. The application is currently open with the deadline October 8th. So you have probably, about 2 weeks to prepare the application if you haven't started yet. You must submit this KHS application by October 8th. And in addition to that application, of course, you're going to submit a master admission application by December 1st instead of February 3rd. So if you apply for KHS, your admission application is December 1st for both master and PhD. It's because KSS want to review the application early and they want to review the KHS and the admission at the same time. So keep that in mind. If you are interested in this kind of fellowship, you have to submit your master application early. In addition to the fellowship, we do have the assistantship. So master students are welcome to apply to any research or teaching assistantship in our department or any department at Stanford. So it's a bit harder to find an assistantship during your first quarter here because most faculty won't know you. They don't know how good you are, how you take the courses, how you know the subject. So it's a little bit harder. But if you are interested in the assistantship, you should contact the faculty directly and send them your CV, your resume, and explain why you are interested. During the new student orientation in September next year, we will explain more about the process and guide you to how to obtain one. So hang with me. If you really need the funding during your first quarter, reach out to me directly. I send you the more information. But right now, I think you have better chance with KSS, and just wait until the new student orientation in September for the research assistantship or teaching assistantship. So I'm going to stop the recording, and then we can answer the question in the chat.